Case study number 13. Summary. Michael Thompson, a 70-year-old male. Michael presents with shortness of breath, chest pain, and a productive cough. He has a history of chronic obstructive pulmonary disease (COPD) and is a former smoker. Current situation. Michael arrives at the emergency department with worsening shortness of breath over the past few days, accompanied by chest pain and a productive cough with greenish sputum. His vital signs are: blood pressure, 130/80ths of a millimeter of mercury. Heart rate, 110 bpm. Respiratory rate, 28 breaths per minute. Temperature, 37.8 degrees Celsius 100 degrees Fahrenheit. Oxygen saturation, 88% on room air. Questions. Question 1. What are the potential diagnoses and pathophysiology for this patient? Answer A. Acute exacerbation of COPD. An acute exacerbation of COPD involves a sudden worsening of COPD symptoms, such as increased breathlessness, coughing, and sputum production. Pathophysiology includes increased airway inflammation, mucus production, and bronchoconstriction, often triggered by infection or environmental pollutants. Key points include prompt management to prevent respiratory failure. Answer B. Pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs, which may fill with fluid or pus. Pathophysiology involves the infiltration of bacteria or viruses into the lungs, leading to an inflammatory response and impaired gas exchange. Important considerations include early antibiotic treatment and supportive care to manage symptoms and prevent complications. Question 2. What immediate nursing care is required for this patient? Answer A. For acute exacerbation of COPD, administer supplemental oxygen to maintain oxygen saturation levels above 90%. Administer bronchodilators, for example, albuterol via nebulizer or inhaler as prescribed. Administer corticosteroids to reduce airway inflammation. Monitor respiratory status and oxygenation closely. Educate the patient on the importance of avoiding COPD triggers. Answer B. For pneumonia, administer supplemental oxygen to maintain oxygen saturation levels above 90%. Administer antibiotics as prescribed. Provide fluids to maintain hydration. Monitor respiratory status and oxygenation closely. Encourage deep breathing and coughing exercises to help clear mucus. Question 3. What diagnostic tests and treatments are necessary for this patient? Answer. Chest X-ray, to assess for pneumonia or other abnormalities. Sputum culture, to identify the causative organism of the infection. Complete blood count (CBC), to evaluate for infection or inflammation. Elevated white blood cell count. Arterial blood gas (ABG), to assess oxygenation and ventilation status. Electrolyte panel, to assess for imbalances due to illness. Pulmonary function tests PFT, to assess the severity of COPD exacerbation. Medication information. Bronchodilators, for example, albuterol, to relax the muscles around the airways and improve airflow. Considerations: administer as prescribed, monitor for effectiveness and side effects. Educate the patient on proper inhaler or nebulizer use. Side effects: tremors, palpitations, headache. Contraindications: known allergy to albuterol. Corticosteroids, for example, prednisone, to reduce inflammation in the airways. Considerations: administer as prescribed, monitor for effectiveness and side effects. Side effects: increased blood sugar, increased risk of infection, weight gain. Contraindications: severe systemic infections, known allergy to corticosteroids. Antibiotics, for example, azithromycin, to treat bacterial infections. Considerations: administer as prescribed, monitor for effectiveness and side effects. Side effects: nausea, diarrhea, allergic reactions. Contraindications: known allergy to azithromycin. Supplemental oxygen, to maintain adequate oxygen levels. Considerations: administer as prescribed, monitor oxygen saturation levels closely. Educate the patient on the proper use of oxygen therapy. Side effects: oxygen toxicity if used at high levels for prolonged periods. Contraindications: use with caution in patients with chronic hypercapnia.